One of the things that came out of the discussion was the very low rate of patients that are elderly that go into clinical trials. So one of the speakers presented Swedish registry data, which showed that in patients over the age of, I think it was 75 years, only 12% of those patients go into clinical trials, compared to about 2/3 of patients that are under the age of 60. So I think we really need to put these patients into clinical trials, because if we don't put patients into clinical trials, we're never going to be able to move treatment forward and find the treatments that are going to work for these patients. I think it's a multiplicity of reasons. Often these patients are less fit, so they're deemed not to be fit enough for treatment, but also there's a degree of probably nihilism in that the treatment's unlikely to work in an older patient, and we know the outcomes for patients with acute leukemia. They often have worse genetics, they're often a lot less fit when they're older, they're often on a lot of other drugs, which then makes treating them much more complicated. So I think it's a combination of factors, and I think it's something it's really important that we address.